Hi guys, welcome back to my YouTube channel, The Mental Health Quarters. We are continuing with our Mental Health Beyond Borders series. And today I brought someone all the way from South Africa. Before we get into the conversation, can you please subscribe, hit the bell button so that next time a video goes up, you'll be one of the first people to be notified anytime my video comes up. So let's just get right into the conversation. You're welcome to the channel, Claudia.
Thank you. Thank you so much for having me.
Yes, you are one of the people that's when I started my Mental Health Beyond Borders series. I wanted you to come over, but I just didn't tell you, but I had you in mind all the time. And I just want to give people a little backstory about how I know you. So I think we met in 2020 when I joined the Global Mental Health Peer Network. And at the time I was a country leader for Ghana. And that's how I got to be part of the network and meet you. But we have never met physically before. It's just virtually. Yes. And one thing I love about Claudia is you can send her a message or email and she will always respond. She will always respond. And she's such a nice and sweet person. And I'm very, very grateful for that. I'm very patient and understanding. So thank you for always being kind, Claudia.
Oh, thank you. That was so nice. Thank you.
It's the truth, though. It's the truth. I've worked with other people before, so I know what I'm saying when I say people don't respond to messages. Yeah.
Fair enough. No,
Yes.
I mean, and you're right. We did meet in 2020. That's when I joined the network myself full time.
Oh, really? I thought you were already in the network.
I actually was, but not as a full-time employee. So when we met, I had officially joined. But that's, I think, something that we'll go through during the questions. I think it will pop up in there.
Yeah. So, Claudia, would you like to give us a quick introduction? Why am I even saying quick? Take your time. Introduce yourself to my viewers so that they know who you are.
Sure. Thank you. Again, first of all, thanks so much for having me. My name is Claudia Sartor, and I am Deputy CEO at the Global Mental Health Peer Network. Something about myself. You just want something random, like just
anything? It could be a fun fact, anything.
Okay. Okay, so I am probably the biggest Christmas fan you'd ever meet. I start celebrating Christmas in September. So I'm one of those. I'm one of those. All my stuff is already up. Yeah, so for me, Christmas, and I love music. I love to do yoga and meditation. It's one of the things that I do every single day. Love spending time with my cats. I've got 2 ragdoll cats. Yeah, I don't know what else is so fun about me, but basic intro.
Yeah. And I would love everybody to know that it's not just Claudia who is a big Christmas fan. I'm also a big Christmas fan. I have my wreath here. Is it a wreath? What do you call this thing?
Yeah, a wreath. Yes.
Yes, so I'm also a big Christmas fan.
Oh, amazing. Okay, good.
Yes. So it's good to know that I'm not the only person who loves Christmas. Yes. And so, Claudia, what's your nationality? I already said you're a South African, so but maybe you have dual nationality or something.
I do, yes. So I have dual nationality, South African, Portuguese. So my family are all from Portugal. So they actually, my mother and my gran and some of my other family members are still living in Portugal, but I was born in South Africa with my sister. So we're South African Portuguese.
Oh, okay. That's nice. That's nice. I've always wanted to have dual nationality, but I'm full-time Ghanaian.
Full-time. There's no going back.
Yeah. And I've never visited South Africa before, but it's one of those countries I would really, really love to visit. So when I'm coming to South Africa, please, which place would you recommend for me to visit?
Oh, well, it depends what you want to do. If you want to see, I suppose, if you wanted to see the the wild, you would go to the nature reserves. But if you wanted more of a touristy, going to the beach and having a little bit more to do, I would go to Cape Town. I would suggest Cape Town. It's a really nice place to go. But yeah, otherwise Johannesburg and sort of going that side will take you to the animals.
Okay. Now I have some places to go. I'm going to pray about it. Okay. So I'd like you to complete this sentence for me. Claudia is happiest when ... I
love that. Okay. Claudia is happiest when she's spending time with her nieces.
Wow, you're an auntie. Rich
I'm an
auntie. I see. That's nice. Your nieces will be really blessed because the way you reply my messages, I'm sure you give them all the attention in the world.
I do.
Okay.
They are lucky. I'm lucky actually to have them, but yeah, love spending time with them. It always brings me such joy and happiness, and it's all real. So yeah, love it.
Yeah. And being part of the Global Mental Health Network, I knew that from the very start that everybody who is in the network is someone with lived experience or is a passionate mental health advocate. So I'd like to know, when did you decide you wanted to go into mental health advocacy? Like, what led you to it?
Really good question. So I battled a lot of my younger days with anxiety and ADHD. It was undiagnosed for a very long time. However, thinking about how I got into advocacy, I go back to, I think, 2016, I would say. So that was the third time I was hospitalized. And at the end of that particular hospitalization, I remember our group session, the very, very last one. And the psychologist had said to us, now each one of you are going to, before you leave, you're going to think about what are you going to do next? And I was like, what does she mean? I can barely think of leaving here. Like, what does that mean to, like, what am I going to do next? And I thought that was such a good question because I didn't think they really cared to ask us something like that. And that kind of just hit like a switch. And I was like, that's such a good question. So initially I thought, okay, I'm going to study psychology because then also, you know, it might help me understand a little bit more about what's going on. And once I started studying psychology and attending classes and listening to what was being taught, I was thinking, but people don't know this. And if I think about the theory that they're teaching us, plus the experiences over the last 10, 15 years, there could be something more I could give. I just didn't know it was termed advocacy, right? To make that difference. So I kind of ventured into that, but I didn't know it was advocacy until I started reaching out and talking to people. And that's when I realized that's sort of what I want to do. And I met Charlene, which, as you know, our CEO, when I reached out to her, she was working at an organization. At the time, there was no network. And they just put me in contact with her, and all I wanted to do was just volunteer and learn more. And then she said, well, this is actually called mental health advocacy, and you know, you're in the right space. So that's how I got into it.
Okay, that's really, really nice. I mean, Charlene, you met the right person at the right time. And Charlene too is a wonderful person. And I'm really glad that in trying to find healing and solution for yourself, you found out that as you are understanding yourself, you could also help people to understand themselves. And I'm really, really glad you took that part because you are a huge asset to the mental health community, both locally and internationally. So if you never went down that route, you would have really missed out on a lot. So Claudia, having lived experience with anxiety and ADHD, your road to recovery, would you say that it's been easy, it's been smooth, or you just had it right from day one till now?
Yeah, it's such a good question because so as a child, I never quite understood what it meant or what I was going through. And I remember, at school having difficulties with boredom. I was always bored at what was happening at school, with this, like what we were being taught. And then I couldn't focus. And I remember then having to go to remedial classes, and it kind of was like, well, I don't not know what this is. I'm bored by it. So can someone kind of come to the party and help me? Or, and then, so it just became really difficult. And I always then got along with the older kids because the conversations were just different. So I didn't know that now. Well, at that point, going back now, and I speak to my mom quite a bit about it, like now, not so much even as a teenager or early adult, but looking back now, I can see where the signs were. And my mom will even say she wished she had understood or knew what those signs were so that something could have been done. And so it was difficult. And then once there was a title to what this thing was, this thing that I was battling with, then it was about, how do I navigate people not understanding what I'm going through, right? The ups and downs of ADHD is really difficult because you kind of go into Ferrari mode, and you go and you go and you go, and then when you hit a low, you hit a real low, and
Wow.
then right, so you got to learn how to balance it. So it was very, I wasn't particularly stigmatized against, but there was a lot of lack of understanding. And then because people don't understand, they don't take time to understand. So it kind of creates that ripple effect of not wanting to invest a little in what's happening with that person. So that's what I had. And then at the workplace, before joining the network, when I was working within like a legal department, I battled a lot with the focus and concentration, and asking for reasonable accommodation, and it was just really difficult. People were just not getting it, and then they thought once a week would be fine, but it doesn't happen like that, because that one day could be a good day for me. So there would be no point in me sitting in the office with headphones on and in a separate office on the good day. I needed it for the bad day. So I think there was just a lot of misunderstanding, and no one really wanting to know more about what was going on.
Okay, so usually I meet people and they have ADHD or they just have anxiety. So I'm just trying to understand, like, this I don't know, do they call it comorbidity? That combination of two different conditions. Anxiety alone is tough. ADHD alone is tough. So combining it together, how were some of the symptoms like?
Well, it actually was, I was even misdiagnosed with bipolar, because a lot of the symptoms
When you were talking, I was like, that sounds like bipolar disorder.
Yeah, so I was diagnosed with bipolar, and I was on medication for that, but it wasn't working. So then I moved, I think I went to three or four psychiatrists, and it was at the last, when I went to go see the last psychiatrist, who's still my current psychiatrist, which is amazing. And she was like, let's scrap everything. Let's start with how you're feeling right now, what's affecting you right now. And we took the symptoms that way. And then that's when we realized there's this comorbidity. And every now and then, even OCD creeps up because of the anxiety, right? With anxiety, you try to self-soothe. So if that means putting all the books in line, or making sure the dishes are done this way, or so that was all of that. And it's hard. It was really, really hard. And even today it can still be hard. Obviously manageable. Hence I do a lot of mindfulness and a lot of yoga, because that does kind of just bring me back to the present, which is the most important for both anxiety and ADHD. It's trying to get to the present. So with anxiety, you're worrying about the future.
Yeah.
ADHD, you're in the future because you're so busy and you can get yourself there. And then when you hit a low, you kind of go back to the past. So you're never at the present moment. So that was one of the things I really had to learn, is how do I get into the present moment?
Okay. You said earlier that you have not really been stigmatized or discriminated by other people. I want to know, did you ever, stigmatize or discriminate against yourself?
Always. I always did. I always thought there was something wrong with me. And, you know, like, as an example, having the opportunity to study at a university and get a law degree, but then I wasn't happy with it. That just in itself made me go, you're not a good enough person, and so on and so forth. And then it started spiraling without realizing that there was actually a lot of underlying issues that were happening. But I was continuously, from something as simple as that, saying, you have the chance to be a lawyer and doing your own practice, but you're unhappy and you're struggling with ADHD and you're struggling with anxiety. So I always blamed it on myself, always. And that I was not good enough to be part of a society that's thriving because I couldn't put myself in that place. So self-stigma was something I did battle with for many a year. Like it really took a toll on me. And every now and then it creeps up, but then I remember what I do every day, right? And
Yeah.
the role I play. So, but yeah, definitely.
Yeah. And I'm just glad that you did not give up. You got a second opinion, you got a third opinion, got a fourth opinion. On my journey to my first psychiatrist thought I had schizophrenia. So we got a second opinion. I was finally diagnosed with bipolar disorder. So this is
Mm.
very encouraging because sometimes people think we always got it on the from the
Yeah.
start that this is what I have. But sometimes
Yes.
you just need to see someone else. Otherwise, you will never get to the roots of your problems. With mental health advocacy, what are some of the highlights of your career so far?
The highlights of my career.
Yeah.
Okay, so I think for me it was the actual transitioning into mental health advocacy. So to give you some context, I actually have a law background. I studied law. I ran my own practice for a few years. It was just something that just didn't quite fit for me. I was just not happy in that space. And then all the hospitalizations happened. And then I went into advocacy. So that transitioning for me was huge, right? Because initially I felt like I was not going to make something of myself. Like, how could I have gone from having a law degree, having my own practice, and then suddenly, like, now I'm in this field where I'm just this one person with an experience and I don't know what to do with it, right? So just the highlight itself for me is the actual step into advocacy. And then with that, I think the other one was or is so in before it was 2019, I was actually the chairperson for the Global Mental Health Peer Network, for the board of management. So that was completely a volunteer role, of course, but that was a stepping stone for me. And the highlight from that is when I moved into a full-time position as deputy CEO, because that for me kind of, it was like you did something. You managed to go from this volunteer position into an employed position where you get to make a difference. You get to make a change. And somebody believed enough in me to take me from one spot to the next. So that I would say would be one of the highlights. Then I think maybe like the third point for me would be, so as a nonprofit, we obviously we battle with funding, or we did, to do our work, and we came up with the Experts by Experience Consultancy Services, right? Which is, for those who don't know, services delivered by people with lived experience to the greater population. And once we created that, it really became my baby, and it's something that I became proud of, right? Because not only is lived experience acknowledged and recognized now, but now it's valued to an extent that we can provide services, and we really pushed for that. And in my career, that was a big thing because that was something I wanted to do in the network. And now that it's going for 2 or 3 years and I'm leading it's also like a little bit of a personal achievement while still being part of an organization, and its objectives, and building partnerships with the right people, like you said earlier, connecting with the right people, and establishing like service delivery for people with mental health conditions.
Yeah. I'm really happy about that because before I joined the network, I knew my lived experience was valuable, but the way when you join the network, people emphasize on, look, your lived experience, expertise is valuable. Like, you have to take it seriously. Don't just think that you are a nobody and your story isn't important. You can use it to help people. So don't allow anybody to look down on you. And those are some of the challenges of being a mental health advocate in Ghana. I mean, sometimes I go for speaking engagements. The psychologist is probably given more time to speak, the opportunity to do presentations with their slides. Psychiatrist is given that opportunity. Then you, the mental health advocate, they come to you, can you, like, make it quick?
Yeah.
We don't have time. I'm like, my story too is valuable. What do you mean by I should make?
Absolutely.
It's
I know.
so bad.
It's sad though that it's still happening, right? Because the thing is, to me, like, I don't even like to use the word story, like when we talk about our stories, because it's actually not a story. It's an experience, and it's a journey, right?
Yeah.
So I always feel like if you're going to give somebody else a chance who can speak from a different perspective, so you have your psychiatrists and psychologists and researchers who have their right place to speak about the stuff they know about, but then we should not be excluded about the stuff we know about, our journeys, our experiences. It goes without saying you can't have the one without the other. Otherwise, it's really pointless. It's a pointless exercise.
Yeah, right. On point. And working with mental health advocates locally and internationally, what are some of the challenges that you have faced in your line of work?
Unfortunately, still quite a bit. I think, I mean, there's the obvious, which is probably the hardest, which is the language barriers and the cultural sensitivity that comes with that. Working with so many people, it's really difficult to get everybody on the same page, everybody to understand that different contexts mean different things. You cannot say certain things in certain ways, and that's difficult because as an advocacy organization, you're trying to essentially change people's minds for the better, but now you have to do it in a way that hurts no one, right? And that's hard because you're trying to make everybody happy. And that's the difficult part. And then, of course, the language and the literacy is also, something else, because you need to be able to speak to the people that are being affected by things. And that's normally at community level. And if you can't talk and we're not speaking the same language, literally, and also same vocabulary, that becomes really difficult. And that is why it was so important for us at the network to make sure we get people from all over the world so that shines through when we are advocating, that actually we have this diverse setup and diverse voices and recommendations, and that way we try as much as we can to close that gap between culture and language and literacy. But I mean, we can get past that because as humans you can talk to each other, so there's always that. But the biggest challenge, I would say, for advocacy organizations and even maybe just an individual is the lack of, or maybe not lack of, but insufficient funding that goes to advocacy, right? Because it's so ironic that people want, the aim is to make changes, but the advocacy organizations are not getting the money to advocate for those changes, right? So it's kind of like money goes to research, lots of research projects are happening, then the findings come, but then what happens after getting the findings? You have to advocate for that, right? But the money goes to the project for the research and not necessarily to the advocacy that should be happening afterwards to make changes. So I really feel like advocacy organizations and individuals that are trying to make these changes are not invested enough, that people are not invested enough in, or like in them, funders, I mean, your grant giving organizations, philanthropists, if they could just look at, forget what's happening on the ground, let's look at what people can do from an advocacy perspective, and kind of filter the funds through there so that they can make the change for people, because that's what an advocacy leader does, right? And without that proper investment, sometimes we do get stuck and we can't go further.
And that's what makes the whole work difficult. Sometimes I have people complaining to me in Ghana that our voices are not loud enough. I didn't hear about this program. I didn't hear about this event. I told them, the funding is the problem. That's why,
Yeah.
because when I was outside the mental health community in Ghana, I had no idea about mental health. I didn't even know people worked in the mental health space. I had no idea. It's when I came in, I realized, wow, people have been working here for many years and still their
Right.
voices are not
Yes.
loud enough. Yeah. And
Yeah.
so you are definitely right. Funding will make a whole lot of difference. And I was
Yeah.
also curious, what's the quality of mental health care in South Africa like? Because here in Ghana, the government doesn't really invest into mental health. It's like 1%.
Yeah.
Not really a priority. It's now that they are
Yeah.
just, trying to do a bit of change, put some of the psychotropic medication on the health insurance. Even that one, I'm here praying that it really goes through. So I'm curious, how is it like in
Mm.
South Africa?
I must be honest. I mean, for me, my medicine's not covered by our medical insurance. So
Mine,
that's just through and through. Unless you're on an extremely expensive scheme, medical health scheme, it won't be covered for. Psychiatrists, it's expensive. It's extremely expensive, and I don't think it's readily accessible to those, to community levels. And I think the problem here is, so we have traditional healers, as I'm sure you know, right? The
yeah,
traditional
we
healers.
do too.
Yeah. And so they then become the point of contact for people, and rightfully so. And there is a place for those people. There really is a place, as in an alternative to care. But an individual is now stuck because of unemployment, really bad socioeconomic status, right? Poverty. They can't go get help. And that you have to
Yeah,
earn a lot of money to be able to get good care. Let's just put it that
yeah.
way. And it's very not person centered.
Mm,
It's I was like I said, fortunate enough to have the same psychiatrist now, and she was so different to all of them. But had I not seen her, I don't think I would have been in the same place. So
yeah.
the quality of care is something I'm very skeptical about
Mm,
in I think in this
mm.
country, in Africa generally.
Yeah, it's an African thing, and hmm, that's why we are still in this space. There were times that I tried to leave the mental health community and go and work somewhere else and do something else. But when I think about the fact that people are struggling and people will continue to be diagnosed every day,
Hmm.
I just can't turn my back on the fact that we
Yeah.
still need to stay and then help as many people as possible. I see our jobs as, like lifeguards looking in the pool of life. Sometimes people are drowning, you
Yeah.
try to get them out or prevent them from drowning. And
Yeah.
yeah, so I agree with you. Totally 100% agree with
Yeah.
you. I hope
I
that,
like in South Africa, particularly, we don't understand why, but peer support is not even mentioned in our legislation when it comes to mental health, and that's such a fundamental part of recovery or seeking help. So we don't even have that, and then we look at Europe, who is so fully pledged towards peer support, and they've got so many programs, and it's so good. And then you've got Zimbabwe, who's got the friendship bench, and we don't even have peer support in our legislation, which is shocking.
yeah,
It's
it's the same here. It's really important that we take these things seriously. And I pray that in the next 1 year, 2 years, some of these things will end and people will actually start paying attention to them. So what's the future for lived experience mental health advocacy when you look at all that is happening now?
Yeah. The future is lived experience, I think.
Yes.
In the mental health field, yeah. um, it's lived experience. I don't think anything can happen moving forward, or if we want to improve care and system policies, research, you cannot do it without lived experience. It's just, I mean, I can definitively say you can't do it without lived experience. And I mean, if we think about how things have progressed from years of advocacy where it was about stigma and discrimination, whilst that continues to still be the thing, we're looking at now there's the value of lived experience is finally kind of got the go ahead, right? It's been finally established and recognized. So the value is now we're carrying on the advocacy for fair remuneration. So as we are going, we're going one step closer and closer and closer to having a proper say in the system at a global level. And I think our biggest space right now is with researchers, because they are taking in lived experience as a big role, which is great. But I think from then we need to evolve and take it further, that advocacy organizations and lived experience leaders get to take that route. But I think just in the global mental health sector, it has to be completely driven by people with lived experience.
Yes, and I can't wait to see what the future holds, because we are really, really doing a lot, and it's high time that people start taking our expertise seriously and realizing that without the lived experiences of people being out there, certain things will not happen. Personally, the reason why I decided to take my mental health seriously, because I was non-compliant with my medications for 1 year. I was in denial. It was when I listened to a podcast of someone, a pastor, saying that there's nothing wrong with seeking professional help. Then a year later, I met my friend Abena, who is a person with lived experience, and I saw, she's thriving like me, she's fine. So
yes,
one of the reasons why I was deep in denial was because I couldn't believe that anybody with a mental health condition could graduate to university and hold a position. I was like, no, what I know is when you have a mental health condition, it wouldn't be long, you'll be on the streets, your life is over. So getting to see someone like that made me realize, okay, then it's not really over. So sometimes stories of hope, resilience, it just speaks to other people and makes them realize that, you know what, it's not over, it's not a death sentence. You can get better, and you can even, when you get better, you can even help other people. So I just want to thank you for all the work you've been doing in the mental health community, locally, internationally, and your reward is coming. Your reward is coming, and it has already come. Yes, thank you. Thank you so much. Do you have any final words?
Final words? Maybe to our future leaders, just running off what Esanam just said in terms of the power of your experience, your journey. If you're thinking about mental health advocacy as your career, I would say, really think about what that means to you, the power that your experience has to help others. It could even be people you know or strangers. You're going to help someone, and don't underestimate the power that you have. And I think, for me, when I was starting, it was so important to have a mentor, right, to guide me through the process, because I wouldn't have known what to do. So if you're looking to become a mental health advocacy leader, I would suggest looking out for organizations that provide mentorships and support, to teach you how to go there. Then you make your decision on your own as to where you want to go. The network is always a good place to start. S&M, and we've evolved so much, but remember that when you do share your stories or your experiences, that it's going to happen a lot in the beginning of your advocacy career, but that's not where it ends. It's not just sharing your story anymore. It's going to be sharing recommendations and perspectives because of what you went through, and that's how you're going to help change policies and legislations, and keep it slow, keep it simple, I think just be kind to yourself and be patient.
Thank you so much, Claudia. And I would like to also end by saying that it's high time that we stop stigmatizing and discriminating against people with mental health conditions. You never know what somebody is going through, and if you do have a mental health condition, consider it your superpower. It may not feel like a superpower, But
Mm.
when you have passed through certain things, you realize, wow, I'm actually really strong and powerful. And yes, this thing makes me different, but I am
Yeah.
very, very powerful in every single way. So thank you so much, Claudia, for
You're
sharing
welcome.
your story with us. And we hope we'll see you again. Yes.
Yes, I hope so too. Thank you so much for having me.
You're welcome. So goodbye from both of us from Ghana and South Africa.
Bye.
Bye.
Bye, everyone.